Authorities in the Democratic Republic of the Congo have banned large gatherings in an effort to curb the spread of the Ebola virus. The World Health Organization says the outbreak now poses a, quote, very high risk for the whole country. That's up from the previous assessment of high. But the risk of the disease spreading globally does remain low. Let's go now to Chris Ochamringa. He's in Kinshasa for more on this. So, Chris, what's the latest on the situation on the ground?
Well, the number of cases of the Ebola disease have continued increasing in the northeast of the Democratic Republic of Congo. According to the latest figures from the government and the World Health Organization, there are about 750 suspected cases and 177 deaths. And these experts are saying that these figures are likely to be less than the actual scale of the problem, because when this outbreak started being reported in Ituri province about late last month, there were many cases that went undetected because authorities in the D.R.C. didn't have the right equipment to test for this particular strain that is circulating there. And that has created a lot of fear. There's also another issue about some of the community members who don't believe that Ebola exists. They think that this is just a fake disease that the health workers are announcing so that they can get money and, take over their land. Some people are even saying that. So they have been taking their sick to traditional healers instead of the healthcare workers. And that has really hindered the efforts of the healthcare workers to try and stop the disease from spreading further. We've also heard about 3 cases, new cases, reported in neighboring Uganda. And Uganda has suspended all flights and public transport from the Democratic Republic of Congo. And that's likely to really disrupt the livelihoods of the people from the 2 countries.
Chris, let's talk a bit about how one treats those who have been infected, because there is no vaccine for this particular strain of the virus. So what's being done to aid in terms of the people who are affected?
That's right. This virus that's spreading over there is known as Bundibujo. It was discovered in 2007 in neighboring Uganda, and you're right, there's no vaccine currently. There are experts who are evaluating a number of vaccines to find whether they can be used to deal with this outbreak. And we've also heard about some scientists in the UK who are developing a vaccine that could be out for clinical trials in the next 2 or 3 months. So what's happening at the moment is that the D.R.C. government and the international partners are carrying out infection prevention control measures. They are getting people, testing people, isolating them, and giving them some medication that has proved effective in dealing with the symptoms of Ebola: headache, fever, muscle pain. And they say that the key thing is for these patients to receive treatment early. So if they wait and it gets to an advanced stage, chances of them surviving are very slim. So that's what's happening right now, and they're saying that they're stepping up the surveillance. They've also got a lot of support from international partners. The UN has offered $60 million, and a number of other partners like the US, UK have all committed to support the D.R.C. government to stop this disease from spreading further.
Chris Ochamringa reporting from Kinshasa. Thank you, Chris. Let's take a closer look at the situation on the ground. And for that, we have reached Bronwyn Nichol. She's the Senior Officer for Public Health and Emergencies for the International Federation of Red Cross and Red Crescent Societies. And today we're reaching her in Kinshasa, the capital of the Democratic Republic of Congo. Bronwyn, thank you so much for making time for us.
Thank you for having me.
Bronwyn, I imagine this is an incredibly busy and stressful time for you and the team. Talk to me about what you all are doing and what the priorities are for the Red Cross and Red Crescent on the ground.
IFRC has launched a regional emergency appeal for this outbreak to support both DRC and the Uganda Red Cross, as well as some of the other surrounding countries, to strengthen readiness at the moment. We're really focusing on grounding this in communities to strengthen community level response to this outbreak and to really increase levels around risk communication and community engagement, contact tracing, surveillance, as well as access to safe and dignified burials.
Let me ask you about the campaign on the ground and in the communities. I'm reading that your teams are going door to door in some of the worst affected areas. Talk to me about the challenges of that kind of work.
I mean, the good news is these volunteers, this is their community. They're working, they're supporting their communities. This is where they're from. They were there before the outbreak. They'll be there after the outbreak. So they're already well known in the communities they're serving. However, there is still some mistrust and concern and fear around Ebola, as there is every time, with people really being worried about what this means for them, how this species of Ebola, so Bundibugyo virus, how this is different from Zaire Ebola, and why this changes the response a bit, because they're used to seeing a vaccine as part of response to Ebola, but that doesn't exist for Bundibugyo virus, and so it changes things a bit, and it makes people question the response and why it's different than usual.
Well, I'm glad you're mentioning this, Bronwyn, because as you're speaking, we're showing images of that hospital facility that was set on fire by some people where Ebola patients were being treated. And this links back to one person who died of Ebola. The family and loved ones wanted to take him out of there to bury him. But of course, Ebola is so easily transmittable. The medical facilitators did not want the body taken away. How do you manage that mistrust?
I mean, you just always have to remember where that fear comes from. Ebola is a scary thing. Imagine people showing up, someone you love dies, and people show up head to toe in full PPE and are changing the way you typically bury a body. Your cultural traditions, the way you deal with a funeral, all have to be shifted. So this is part of the process when we do safe and dignified burials, is to really have this conversation with families, with communities, with religious and traditional leaders about what this means. What pieces of regular funerals can we incorporate into a safe and dignified burial to make sure that traditions and beliefs are still respected within the process, and making sure that families are able to watch or witness or participate in different manners, depending on safety as well, into the burial, so that they can see it is actually their family member that is being buried. It's not someone else. That is often a concern as well. People often, there's concern about where the body goes, making sure people are able to follow that process through the burial piece into when the body is put in the ground as well. So it's a lot about community engagement, working with communities, making sure these pieces are well understood, and that's always a bit of an uphill battle.
Let me ask you about the fear of this spreading further, particularly after COVID-19. Right now we're dealing with hantavirus. There's a lot of concern globally about spreads of communicable diseases. Now, I know most of the work is being done in Congo and Uganda, but there are reports indicating that perhaps Rwanda, Burundi, South Sudan might have cases of infections. What are you hearing on that front?
I mean, hearing news of suspected cases or things being investigated in other countries, in a way, is also a piece of good news. It means that surveillance systems are working. People are picking up the signal of what a case definition is for Ebola, which at the beginning could be a lot of things. It's quite similar to malaria often as well. So it's good that systems are picking this up and that they are being investigated. That means, as a whole, system is doing what it should be doing. But we also need to remember not to panic too much. Closing a border doesn't change anything. People are still going to move across borders, whether a country is officially open or not, and also making sure to think of this with compassion as well. This changes everybody's lives, people that are living with this day to day. So making sure, yes, we want to talk about public health as a whole. Countries want to prioritize the public health of their citizens, but how can we do this in a compassionate way that still views everyone as a person?
How would you compare this current situation that you're dealing with the outbreaks we saw in 2014 and in 2018?
I mean, what we're seeing now is a bit different because it is the Bundibugyo species, which we haven't seen in quite a while, and doesn't have any of the supportive elements. So in some ways, it is a bit reminiscent of what we saw in 2014 in West Africa, where it was in a new place for the first time. We didn't have vaccines at the beginning of that outbreak either. So we're coming back to how do we treat this disease? How do we respond to this disease when we don't have vaccines, when we don't have therapeutic treatments that we do have for Zaire, which we've become reliant on. So really this brings us back to surveillance, contact tracing, and making sure communities trust the response, and making sure we're able to do burials safely as well.
Bronwyn Nichol, thank you very much for your time today, and I wish you and your teams a lot of luck.
Thank you.